Fantastic. Well, very good afternoon, everyone, and thank you so much for joining us. I think we will give it just a few more seconds before we kick off. I'm really excited about today's session. Let me just have a look. I can see people dialing in. I will start by saying obviously Rob was due to be on the call hosting, but due to some last minute changes, I am stepping in. By way of an introduction, I am Latief Ziada from Graphite, and I will be the host and moderator for this session on ROI in pharma digital. Now it's obviously quite an important topic, and it's been on the agenda. It's always been on the agenda, but it's increasingly becoming more important to senior leaders, not only to understand, but also measure and communicate in order to recognize the progress. And often we're finding to get that buy-in from stakeholders and internally from the business. I think metrics like engagement rates, click-throughs, they still have their place, but they don't tell the whole story. And between us, I'm sure we can appreciate and accept that actually more than metrics, it's about delivering meaningful impact. And that's for both the audience and the business. Often we try and think about those impactful measurements as being related to business impact, so performance or efficiencies. Above that, we're thinking about how we're changing prescribing behavior. Ultimately, I think we agree that it should come down to how we're supporting an improvement in patient outcomes. Now, this is obviously something that's come up, and more recently, we produced a white paper called the Digital Reality Check. I think we'll put a link in the chat shortly. But that was launched a few months ago, and it was informed by a piece of research we did where we spoke to 100 digital leaders in pharma and life science. And some of the stats that came out of that is that only 45% track business impact and 29% seek out first-hand customer insights. So I guess while investment in digital continues to grow, the way we define and measure ROI is evolving, which is why I'm so delighted to be joined by two amazing panelists, Alyssa and Florent, who bring so much experience and will share their perspective on ROI. I'll do an introduction shortly, but just to set the scene, we'll do 35 minutes of a discussion. I'd like this to be really conversational, and I'll pull in questions so that it flows well. I encourage everybody to put their questions into the chat, as well as their perspectives. I think let's try and keep this as lively and as fluid as possible. However, we have also allocated and dedicated 15 minutes at the end for any questions we may have missed. So we'll give Alyssa and Florent a chance to go back and answer some of those questions. So without any further ado, I think we can kick off with the intros. Now, I'm so pleased to be joined by Alyssa Fenoglio, a VP level executive specializing in digital. Alyssa leads teams across omnichannel, customer experience, AI, and commercial excellence, always trying to drive real transformation and measurable value in often complex and high impact environments. She also is an advisor to the Global AI Leaders Network and the WFA AI Steerco, where she helps to shape the future of responsible, ROI-focused digital and AI strategies. Thank you so much, Alyssa, for joining us. Of course, you're going to bring an immense amount of experience across commercial, your leadership experience, and hopefully we get some practical thinking around what makes digital truly valuable. Hi, Alyssa.
Hi, Latief. Thanks for the invitation. Happy to see you.
Likewise. Equally, I'm so excited to be joined by Florent Edouard, Global Head of the Digital Accelerator at Sanofi. Now, Florent has a long track record of leading transformation across pharma with senior roles at Sanofi, Grunenthal, and AstraZeneca. He's delivered major global programs spanning omnichannel, AI, commercial excellence, and obviously CX, with a real focus on results in terms of both revenue growth and operational impact. Florent has also spoken about the commitment that Sanofi has to the build, not buy approach when it comes to AI. So that's an area we'd love to explore further. And again, thank you so much, Florent, for joining us.
Well, thanks for the invite and looking forward to discuss with Alyssa. It's going to be great.
Absolutely. Thank you both for joining. So let's get started. I think it makes sense to start at the beginning with the fundamentals. I think ROI is a term we all use, but often it means very different things depending on who you ask. Alyssa, I wonder if I can start with you in the context of digital. What does ROI mean to you?
Sure, Latief. So first of all, I think you teed this up in some of the stats that you mentioned, but we have to speak the language of business leaders and the C-suite. Full stop, right? So I think what does ROI mean for us as digital leaders? It means we have to talk about measurable impact for patients, HCPs in the business. And I think one of the primary learnings we've had during the digital transformations that we've had in pharma is that we were measuring ROI of digital initiatives in a silo. They were disconnected from business objectives, disconnected from patient outcomes. And that makes it really challenging to claim success from all of these transformation efforts. So, my experience is that we need to establish clear lead and lag KPIs that connect to ROI of the business. And our lag KPIs are our macro KPIs. These are connected to the P&L. This is patient outcomes, driving behavior change. And the leading indicator KPIs, these are the ones that we can own in digital that actually, ensure that we're setting the right course to meet those macro KPIs. So I think, you just can't disconnect from the business objectives. And I think that's the primary lesson here. And hopefully Florent agrees with me on that point.
Yeah, completely. I think one of the classical mistakes we do in digital or we do in business is to decide we want to do something without a clear idea of the value it's going to create. So that prevents us from prioritizing effectively. And that also prevents us from measuring the impact because we actually don't know what we want to do. Like it's every day that we have people coming saying, I want a website. Why do you want a website? What do you want to achieve with the website? What's going to be the impact of the website? So I think to Alyssa's point, I think the first thing that we have to speak the same language. I would add a second layer immediately after that, which is we need to have one data stack. We need to make sure that our data is not fragmented, that it is governed, that it is clean, and that we can use it for analytics. And that's specifically in omnichannel and in pharma, that's always been a challenge, where we have pockets in Viva, pockets in Salesforce, pockets in Magnolia, whatever kind of systems all over the place. And of course, my data is not your data. So the US data is not the French data, which is not the global data. So we all have a different number and we can't agree on anything. So I think fundamentally, ROI matters because pharmaceutical companies are not non-profit organizations, right? We are all driven somewhere by the benefits we bring to patients and by the return we give to shareholders. Those are the two mantras. And we need to navigate what we do in order to maximize the two of them. And I think that's where the ROI comes into play because there's only so much we can do with the people and money that we have.
Fantastic perspectives there. I would encourage those in attendance to also add their perspectives to the channel. If I could just expand, Florent, on your point, and Alyssa, feel free to jump in as well. Do you feel like the definition of ROI, or what ROI means to people, has changed or evolved more recently? I mean, for instance, you just mentioned both patient outcomes and obviously business impact, and those two being crucial. Has the focus on patient impact as part of ROI perhaps increased more recently over the last 10, 15 years? Or what's your view on, has there been a shift?
So yes, first, because I think we have all agreed that return does not always mean financials. So that allowed us to go beyond the pure commercial activities and to make sure that we did meaningful activities that were having the expected impact. So that's really one thing. The second thing is, I don't know who, but someone invented the denomination vanity metrics, and I would like to kiss his or her feet for doing that. Because by naming those vanity metrics, it clearly labels stuff that, in fact, people are very proud to show, and that doesn't give you anything in terms of driving your business. So I think, yes, it has considerably evolved, but as well as the cross-functional working has evolved. I mean, we used to have very, very siloed pharmaceutical companies where market access wouldn't talk to medical, wouldn't talk to R&D, wouldn't talk to commercial, and things like that. Marketing wouldn't talk to sales. I mean, I came in an AstraZeneca organization where marketing and sales were actually in competition, right? This has changed, and this has changed for the benefits of patients and HCP. So I think the landscape around ROI has considerably evolved.
I'd agree with you. I think it's certainly evolved, but I still would say we have a lot of work to do to really get it to a place of excellence. And I know we're going to talk a bit more about cross-functional collaboration next, but it's definitely the course is the right direction, but still a lot of work to do in our industry.
Fantastic. Thank you both. And I think that probably sets us up perfectly for the next piece, which is focused more on measurement. I guess, Florent, let me come to you on this one first. So measurement is always tricky. How should teams approach ROI? Not just in terms of metrics, and obviously we'll talk about what you mentioned there, vanity metrics versus impact, etc., and business outcomes. But not just in terms of metrics, but in setting expectations with stakeholders.
So, well, when we have a business function, for instance, coming to us, or when we define a marketing strategy or a tactic, let's call it a marketing tactic. The first question we ask ourselves is, what is the value we want to create? The second thing we ask ourselves is, how are we going to measure that? So for instance, let's say that the value you want to create is for patients to be more informed about the side effect, whatever. The action is downloading a leaflet. So that's our value action. And then the question is, what is a good target? Where do you want to bring it? And this way, when we start to anchor things this way into tangible behavioral changes or actions, then you can start to talk about ROI. When you're just, saying, okay, I want to do a sales campaign, and that sales campaign need to generate an uplift of 0.5 point in market share, we have very advanced marketing mix modeling tools. They can't really capture that efficiently, even them. So we need to be really mindful of making sure that when we invest money, when we invest people time, we know exactly what is the outcome expected and what does good look like.
Wonderful. Alyssa, do you want to add to that? Are you aligned to that?
Yeah, I am aligned. And I think it speaks, Florent, to your point earlier, when people just want to create a website to create a website, right? I think what you're speaking to and what I'd advocate for is a rigorous contracting process at the beginning of any investment or project. And you're starting with, what's the business or people problem we're trying to solve? And then that leads you to the business objective. What's the value you're trying to create? The KPIs, macro, micro, and who's doing what? What are the roles and responsibilities within the cross-functional group? And I think the other thing with priorities is sometimes these are learning priorities, right? If we're running an experiment or we're running some sort of innovation project, it's not necessarily going to lead to a macro KPI at that point or a lag indicator. And it's okay, right? We just need to make it clear up front with the stakeholders, this is a learning KPI, and this is going to determine if we scale or not, and making sure that the stakeholders are clear on that objective.
No, completely. And I think it's by creating those pockets that you can win the fight. I mean, if you try to come in and say, I don't know, take a big top 10 pharma and say, we're going to put an ROI scheme that's going to cover everyone and everything, you're going to fail miserably. Because you will have everyone against you, basically. Where if you start to create those pockets of people who use it as a daily practice and are healthy habit to understand what's the impact of their own activity and investment, then you can replicate that. Because it becomes far easier for a finance guy to say, you know what, at least I'm going to give 1 million to those people because I know what I will get, rather to 1 million to this guy who is selling me dreams on PowerPoint. And I think that's a good bargaining chip to have when you want to have budgets to deliver your strategies.
No, that's wonderful. And I guess then, Alyssa, to Florent's point, how do you keep those objectives or measurements realistic and not too ambitious, for instance, especially when you think about innovative scenarios or settings where you're producing something new or delivering something new?
Well, I think being laser focused on your scope for each of these initiatives is critical, right? I don't think it also depends on your company culture, right? Do you tend to move fast? Do you tend to invest quickly? Or does it tend to be more decentralized? So all of these things need to come into play, but it's all about being laser focused on what exactly we're trying to tackle and in what scope, what geography, what brand, versus the entire world all at once, right? With a plan behind it to prioritize whatever it is, the top markets, the top brands, whatever that scope is, to make sure that it's achievable to get results quickly. And I think in this world that we're moving so quickly, we have to be agile and we have to quickly test and learn and iterate and see if it's working or not. And you can't do that, across a significant scope, typically in an inexpensive way. So completely agree. It's all about making the right strategic choices up front on where you're focusing.
Amazing. In the chat, there's an interesting comment. Alex asked if you've tried any startup metrics inside pharma, like customer acquisition costs, churn rates, etc. Stefan did jump in to answer, but have you guys had any experience with trying those things or perhaps other things? I think, Alyssa, you know, understanding the scope, thinking about where you're trying to ultimately get to and achieve, and then working backwards to make sure everything's linked. But have you tried any of these things?
So I think a lot of these metrics depends on the market you're in. I think in the US, these are easier to utilize, right? But one thing that I do believe is universal is CSAT or NPS, right? And just at least getting some feedback on the quality of the engagement that you're providing, the experience that you're providing. Sometimes linking direct to customer acquisition can be difficult pending compliance in certain markets. But you're right to ask the question, and we should continue to push more to what other industries are doing and how can we apply that in pharma in a creative way to make sure that we're tying to business value.
Yeah, to be on that, yeah, we also had experience in pharma companies, but also in Sanofi on some of those metrics. What's really important is to have an actionable metric. Like, the customer acquisition cost looks like being a great metric. The challenge with that is no one in pharma owns the customer acquisition. It's split among so many teams, so many centers, so many interactions that actually to bring it down or to look at it going up is not like you can do something you in your own corner for your own brand. So it's a very complicated metric to operate that can create a lot of stress, because the other thing that comes with it, with transparency, with ROI, is visibility on who's performing and who's performing less. That stresses out people. So in those cases, what they do, they pull out the compliance card. Oh, I can't measure because X, Y, Z, or I cannot do that because this is not compliant. But actually, there are people that are paid to tell you what is compliant and what is legal. And I'd rather listen to those people and work with them to do something fully compliant and fully legal. And then we can see that we can do far more than what the common crowd thinks.
Wonderful. Interestingly, in our white paper, one of the stats that came out around challenges that digital colleagues face when thinking about measurements of ROI was compliance. I'll let people check it out, but it was 59% suggested, some real challenges around compliance, and that being one of the things in consideration. Now, we've talked about defining and measuring ROI, but communicating it is a whole different challenge. Florent, from your experience, what's the most effective way to tell the ROI story? So that it obviously resonates with leadership and equally with colleagues. Is it about, well, you already suggested it's not just about the numbers anymore, but do stories and customer voices really carry weight?
So, well, that's the art of storytelling, right? More than mathematics or analytics. I mean, it depends which audience you are talking to. I love CFOs, but when you talk to a CFO, you talk money. That's what they are interested in. So they will want to hear an ROI that can be expressed in market share gain, net financial value in those terms. And you need to be able to articulate your ROI overall and compliantly in that direction when you talk to CFOs. If you want to talk to medical, or if you want to talk to nurses or this type of persons, they are totally not interested into the financial. What matters to them is improvement in patient experience. It's increase in patient being appropriately treated and getting benefits from treatment. So you need to turn it this way around. But ultimately, you can do it. It's all, again, I come back to the origin. It's for you to set the right ambition. What is the high value action I want as a result of my tactic. And then when it's appropriate, you get the right elements to talk to your audience. But you need to tailor your speech to your audience every time.
Fantastic. Alyssa, anything to add there? And can I also just jump back a step when thinking about ROI matrix or metrics? Because we have put in the chat if you can share any examples of ROI metrics towards patient activation, for instance.
Sure. So I certainly agree with Laurent on that. I think, if we take a step back and a company has a very clear strategy and all the leaders are clear on what the strategy is, everyone should be running towards the same direction as an organization cross-functionally. Now, I know that doesn't always happen perfectly or idealistically, but if you trickle that down then to digital initiatives, it goes to stakeholder management, which is what Florent was mentioning, right? So you need to understand and listen to your stakeholders. What are their top business problems they're solving for the patient, for their business, to contribute to the broader business strategy, and aligning on what that problem is. And then everyone's got the buy-in, right? And then success should be co-owned, but you need to assign a clear owner and decision maker and collaborators in a racy model. Otherwise, you get in kind of a circle of no one's making the decision and there's too many owners. You do need to say who's owning this. Not that all the functions aren't contributing, and each function should be clear on what they're contributing and what their KPI is for what they're contributing to the broader overarching goal. And I know this is easier said than done, but it is quite simple when you explain it in that way. And it does help a lot. I see that come to life when people are really clear on what they're doing. They're really motivated, actually, and everyone feels more like a team because they're working towards the same goal, and they know what their role is on that team, right? We all play different roles, whether it's sports or in business. And so I do see success, from approaching it from that direction. Now to the KPIs. Now it really depends on the business problem you're trying to solve and the country that you're in. So it's kind of a general question. It's a good question. I'd say, in countries like the US where you can actually track a bit more closely with the customer, you could manage like number of enrollments in an education program, number of enrollments in, speaking with a internal nurse about a rare disease, for example. It's easier in the US. And I think with outside the US, you can also think about the top of the funnel, think about disease awareness and all the surround sound that you can bring value in your therapeutic area. That's not necessarily about the drug, but establishing your company as, a force for education and knowledge within that disease state.
Fantastic. We mentioned rallying stakeholders. How do you manage conflicting priorities? And silos has obviously been coming up a lot in discussions, and breaking those down and making sure cross-functionally everyone's more aligned and working together. But I guess what's the best way of managing those conflicting priorities? Florent, if you want to go on that one first.
So I can't claim that this is how Sanofi operates, just to be very, very clear, because I've been there only 1 year. But in the past, what I've seen being successful is zero-based budgeting. So you start by saying you have no money, articulate the value you want to create with the money you're asking, so we can write that down somewhere and hold you accountable to it. So I agree, it's a very stressful approach for the teams who think, okay, if I can't prove the value, my job is going to be removed. So you need to manage the people and the change. But I think it's really important that people understand that it's not because you've done something in the past that you're going to keep doing it in the future, and making sure that you're going to keep doing it. Based on those values declared, then you can prioritize. You can say, okay, you want X for creating that value for the company, for the patient, for the HCP, for whoever, or even for the employee of the company. How does that compare to the other investment request? And that's when you can make a trade-off, saying, okay, we're going to invest in this rather than in that. And I think it's an easy way to sort out 80 to 90% of the demand in terms of prioritization.
Wonderful. I'm just looking at one of the questions from Stefan in the Q&A, and that talked about marketers sort of focused on their career opportunities rather than actual improvement for the business. So I'll read it word for word. So for too long, digital projects aimed more for career opportunities for marketers rather than actual improvement on the business. What's your experience addressing the required change with senior leadership?
That's not on the vanity metric, that's on the vanity
No.
project. No, it's true. So the thing is, you need to be ruthless, having good standards for the company in terms of platform, in terms of practice, in terms of all that. Then you can give creativity power to people. Some people have great ideas and they want to come with it, but you need to govern that. For me, if you take, for instance, AI, Gen AI, for instance, everywhere I've been that has worked in this, so both in Sanofi and in Grünenthal, one of the first things to do was to tell the people, okay, you have a playground, you can create stuff, you can, make prototypes or MVP or something that stands run, depending on the company. Then you have to articulate the value, and then we'll allow you to scale. For that, you need to create a governance, you need to create an infrastructure that allows them to play and demonstrate that their product is viable. And I think that's really critical because it will avoid the vanity projects. It will avoid one guy saying, you know what, I have a vision and I'm going to do this, and then I'm going to call this agency, and I'm going to pay them 5 million, and they're going to do something, and then they move before the thing actually hits the market and prove that it doesn't work. So I think, the capacity for the people to start small, prove the value in a controlled environment, and then get the whole support of the organization to scale it is super important.
And I'll add to that, Florent. I think I get the question a lot with regards to how do you influence the senior leaders, right? And I think, yes, we can influence the senior leaders with business cases and value and all the things that we've already talked about. But at the end of the day, organizations are super busy and there's a lot of transformation topics, right? So what I'd advocate for is within the scope that you own, our scope, any scope, you role model behavior that you want to see from your stakeholders, right? So making sure that you're not running off with these vanity projects, making sure that everything has business value and is connected to the brand and business objectives, and incenting your team, coaching your team. And if maybe you're on a team with a leader who's not doing that, trying to have those conversations to influence them to learn and maybe try some of those methodologies out. So I think we can't just wait on the senior leaders to make it perfect. We need to do our part and within the control that we can have.
Okay, fantastic. I can see in the chat someone's put an example, but just from both your experience, can you think of examples where teams have actually successfully linked digital engagement to actual business outcomes or health outcomes?
I have an example that I can share. So again, it always starts for us with what's the business problem to solve. And in this specific case, it was lower decile pharmacy targets were getting called on less frequently by our sales reps. And that sometimes caused out of stock to occur within these pharmacies. And so what our data science team is, they built a model that actually provided customized, personalized recommendations for those pharmacies based on past data. By analyzing lookalike data as well, and produce these customized recommendations in partnership with our in-house agency, who actually built the content, the campaign, and embedded the ordering link directly in that communication. So, holistically, everyone knew what their role was and what ROI they were trying to lead to. And, that program showed an uplift in revenue and customer satisfaction, and it's being scaled.
Yeah, I think there are multiple examples of those. I mean, from the digital solutions that make the patients aware that there is a treatment on the market that is now approved and that they need testing, that there is an evolution in the disease. So it's not, advertising the product. It's saying, okay, you need to talk to your doctor. And that's what people do a lot in the US, for instance. I've done that in a company in the past where you need the people to get tested so that they get a chance to know if they are eligible for the treatment. It doesn't mean that they will get it because it needs to be prescribed and then they need to get access to it. So there's a lot of things. But at least, if they don't know that they could have that disease, then they are not going to do anything. So I think this disease awareness and possibility to understand there is a screening process, there is a testing process, you could benefit from it, is something that translates into patient benefits for the one that tests positive, for instance. But we have multiple examples of that where just digital engagement with HCP help them treat better the patients, take better care of the patients by explaining a certain number of things that they need to do during the time they are patient-facing so that the outcome of the treatment is better.
Now, let's shift gears and look forward. So moving moving forward. If someone wanted to evolve their ROI approach this year, where's the first place they should start? Florent, since you have the mic,
Sure.
so you can go.
Get your data in order. I mean, everything that we say relies on the fact that you know where your data is, that someone is taking care of that data, and that you can exploit it to calculate anything. We have very often super fragmented landscape, and I would say the more we have vendors working for us, the more fragmented the data landscape is. Because if you go to an agency and you tell them, I want a digital solution that does A, B, C, and D, they are going to co-sell you a tool that's going to do beautiful analytics. You get emails in the morning and stuff like that. It's fantastic. That data sits on an island. It cannot be used by anyone. And by the way, it's going to be outdated the day someone in digital says, oh, it should be transferred to the data lake. By the time it's in the data lake, 6 months, 12 months down the line, it doesn't prove anything anymore. So I think the first thing to do is get your data in order. Make sure it's clean, it's taken care of, it's accessible, and it's usable to do analytics.
Fantastic. And Alyssa, if I can come to you to build on that.
Yeah, I think from an enterprise perspective, absolutely. And of course, within a project that you're leading, data should be clean and in order. And then I'd say for anyone, no matter where you sit in the organization, within the scope that you have, you should be assessing and auditing what you're already measuring with regards to digital initiatives. And you should be asking the question, is it connecting to business and customer value? Is this connecting to our business objectives and business strategy? Or are we just doing things to do things because they're cool and sexy and shiny? I think that's a hard question we all need to ask ourselves. Experiments are fine, but experiments forever are not fine. And then I think we really need to start shifting from those vanity metrics to those meaningful KPIs. And I think, when you moving forward from today on, any new initiative, start with the contracting process. Make it very clear what's the problem you're solving, what's the business objective, the KPIs, who's doing what. And if you can go back and recontract existing initiatives, that's great. But that can sometimes be challenging.
I hate bureaucracy, and I'm totally behind what Alyssa just said. This is critical. It can look like, bureaucratic to properly document, and it is not. That's the only way you get people accountable. You can hold them accountable for what they have decided they would do.
Fantastic. And I'll bring in Jag's question. So do the panel have a perspective on how to cultivating the right mindset for ROI approach rooted in value creation, or how to cultivate, sorry?
For me, it starts with role modeling, right? So I think, again, let's not wait for others to do it perfectly, but if you're leading a team, if you're influencing a team, if you're working on a team, role model that behavior and setting up the contracts, setting up the right KPIs, the lead and lag indicators, and then once you have the business results and the business cases, it's easier to tell the story. The other thing I would say, and we talked a bit about stakeholder management, is we have to think about timing, right? When are people's timing right for them to engage? Also, certain people are early adopters and certain people are laggards. That is reality of human behavior. So the key is to partner with the early adopters where the timing's right versus forcing something that's going to be a lot more difficult and challenging with someone who, is more of a laggard, or, the timing just doesn't line up with their organization.
I think, I started working in banking, and in banking, you make money. In fact, you make the bank make money for some rich people who are the bank shareholders, right? That's what you do. At the end, after I'm a bit slow, so it probably took me 10 years to realize, but this is not a purpose. This is not what you want to be here for. This is not the story you want to tell your kids. Why are you going to the office? I'm going to the office because I want to make other people rich. And I think in pharma, we have a different purpose. And for me, the question of ROI is how much of that purpose can we actually realize? If you attach the teams and their actions and their activities to the impact on the patients, if you work on something that is a launch, how many patients, visualize how many patients currently do not have a treatment and could benefit from that treatment. Or if you work on any other activity, how many people cycle between doctors and doctors and doctors before they get the right application of the treatment. If you can help with that, then the question of ROI is instantly solved. Everyone will say we need to do as maximum impact as we can with the minimum amount of money. And I think that's how you attach the mindset of the people to that concept of ROI. We don't have infinite resources, but we have very, very clear problems that we need to solve.
Fantastic. I want to almost go back to the beginning. In that scenario you gave of a website, someone coming saying, we want to put together a website. And the question is, what's the purpose? What are you trying to achieve? And then you start scoping out in the right way. We find from experience often that certain things that should feed into and inform that scope and the understanding behind the need is usually eliminated or bypassed. Things like bringing in the voice of the customer or running research, etc. You just mentioned also that obviously there's finite resources, but should that be something that's on the chopping block? And often it's like, okay, rather than do research, let's just speak to our field force. They know our customers inside out, or it's let's go ahead based on what we believe we know from previous research. I'll give that to Florent and then maybe Alyssa.
First, I'm a deep believer in research. Whether it is user research, whether it is customer research, you need to find insights. If you don't have real insights, which is something new that you didn't know and that is actionable, then you are doing activity. There's no point in what you're doing, more or less. So I think it's really important that you start from there, that you keep that you nourish it, that you store it. And then you are going to be able, based on that, to deliver something for those patients. But research is paramount. At the beginning, you need to do it. And if someone comes with a non-articulated problem that they want to solve with the website, it's generally because they have relied on what they think the people want. And it may not be true at all. Like, today, HCPs look at social media as much as they would look at medical journals, and probably far more than they look at pharma websites. That's not an insight, but that's something that you need to factor in your thinking as well. So I totally believe in the dialogue with the end customer and the end users.
And I agree. I think even one of the stats, Latief, that you mentioned earlier was 30% are actually digging into insights before starting a digital project. I wouldn't say this is a digital problem. This is an industry issue. Having worked in consumer products and other industries, we don't go deep enough to understand our customers. And we think of them with the healthcare hat only. And that's a very small part of their life, right? Being a doctor or being a patient. They are humans and they're engaging with all the other industries like the rest of us. And that's the expectation for experiences. And they go a lot deeper in understanding those humans. So I think what I've observed quite a bit in our industry is there's a lot of confirmation bias. So we may run a workshop just to confirm the consumer journey we already had in our head. And that doesn't lead to insights or creativity or how we engage our customer. And it doesn't lead to meaningful outcomes. So I think the challenge for all of us is really going deeper with the why, and how we get that why can be in a lot more agile manner. I think we also get tripped up a lot with formal, expensive, lengthy research, which has its place sometimes. But there's a lot more agile ways digitally and with AI to gather insights these days. Mining your own data, digital safaris. There's a lot of vendors out there offering, simulations with syndicated data and lots of other creative ways to quickly get insights to help inform your program. And so I think that is a huge opportunity for us to get insights, but in a quicker, more agile way.
Completely. And just building on that. So that's phase one, right? Then you go into your building your product, having the end users sitting with you and going through fast iteration is a must. You need to give them something that they can crack on, that they can get their hands on and give you direct feedback so that you can produce something that at the end will satisfy their needs. If you go for the traditional approach, okay, I come back to you in 3 months with something baked, that doesn't work. Even in 3 months, the people can change. And what we see is that their needs evolve when they see something actually existing. Before that, it's all intellectual. It's all in their heads. It's not grounded in reality. So that co-creation is super important, that you get the initial direction of the product right.
Yeah, fantastic. Completely agree. Co-creation, test and refine, making it really quick as well. And obviously just having that product mindset so that you're continuously evolving and developing. A question on AI use cases. So what kinds of AI use cases do you think will deliver the most measurable value in the next couple of years?
Measurable value to whom? To OpenAI? To... Because I think they're to NVIDIA. I think it depends who's going to benefit from the value. More seriously, I keep in mind as a North Star the discussion with a pain specialist somewhere in the suburbs of New York. When I asked her, what can I do for you? She said, Florent, what I want your WhatsApp number, and I'm in front of a patient, and I want to WhatsApp you what's the side effect of doing this drug with this drug that is yours? And I want you to answer in the next 10 seconds. So I look like that I know the answer. That's what we're going to deliver with AI. And that's where our ambition should be. And that is going to create value for the HCP and for the patients. That's one of the use case where I think we can add the most value.
And I think that just goes back to a more seamless customer experience, right? You're taking a pain point out of that HCP's experience to then provide value to the patient. And I think more broadly with AI, I mean, certainly the biggest value to an organization is if everyone's synced up on certain scalable use cases, you're going to realize more value because it's across more scope, more geographies, more brands. But I also think on the individual level, we can't discount that. Those of us embracing AI and leading and influencing and role modeling, you're going to be able to progress in your career and have more job prospects than if you're kind of sitting back and not experimenting, not using, not learning. So you have to invest in yourself as well and your own ROI and using AI. I think there's a whole nother third element about agencies, internal, external, and how we're partnering and how are we getting the most value out of AI and transparency and those partnerships on where AI is being used or not. So I think that's a whole other area to unpack.
Well, on that, so I at the very top when introducing Florent, I mentioned that he made the comment on build, not buy approach. What's your thoughts, Alyssa, on Florent first?
Right. Now, because
You're ready to go.
I wanted to quote a controversial guy who is the French president who said, "You don't outsource your intelligence." And that was on stage at Vivatech with the NVIDIA CEO, and they were announcing that France, blah, 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 is investing. Irrespective of the personality of the guy, I think somewhere he's right. I think the AI will be tomorrow, the intelligence of the company, a lot of the best practices, a lot of the knowledge, the know-how will be stored in AI system, whether we like it or not. And having that completely delegated to a partner, how lovely they are, is not the right approach because they will follow their own strategy. They won't follow the strategy of their company. And AI is a strategic asset. So I don't say we need to build everything. Far from that. There's a lot of things, we are not going to build the next cloud or the next large language models. We need to use those, but we need to be in control of our AI.
And I agree with you. And I think just to build on that, how I view it is, where do you want to build competitive advantage? This is an internal strategy question. What are my points of parity with other organizations? And what are my points of differentiation? And the points of differentiation, that's where you're unique. That's your competitive advantage. That's where you should be investing and making sure it's proprietary and internal. And then, shades of gray, depending on what you borrow or what you partner with. You can't do everything though, right? And we have limited budgets, as Florent mentioned. So you have to make choices, but it should be invest in those areas of competitive advantage where you're differentiated in the market to create even additional value. And then maybe outsource or partner or have different types of borrow scenarios with the other areas.
Fantastic. We had a few questions come in before the session, and I want to do the attendee justice by bringing this question up. So, but when thinking about the brand lifecycle, the question was, should we expect a different ROI if brands are mature, in more growing phases, or in launch phase? Any case studies supporting or suggestion to optimize related KPIs?
That's a broad one. That's a broad one. I mean, we would need 1 hour to, deconstruct and articulate the answer. For me, the answer is yes. It is linked to the brand, the phase of the life cycle. And we see, like, for instance, brands that are end of life, and we have many companies who have those portfolio. Your marketing mix modeling tells you how to optimize all the resource allocation that you do between your various channels so that you get the maximum sales for the lowest possible cost. And that's a common practice. And there's nearly no more field force promotion and stuff like that. So I think it's one of the metrics that you wouldn't track, for instance, at the beginning of the launch of a product, because it doesn't make any sense. The value is future.
That is, I think we are coming to the end. So I wonder if I could just ask you both for a final thought or leave behind for the audience. Alyssa, if I start with you.
Sure. I mean, I think in summary, right, always start with the question of what's the value I'm creating for the patient, for the HCP, for the customer, for the business? Is it connected to the business strategy? And am I clear on the problem that I'm trying to solve? And I think if you have those clear, everything kind of ladders up.
Amazing. And Florent?
Well, on align with what Alyssa said, I would just add, don't think ROI is a slur word. Ask compliance and legal for what you can do and what you cannot do, and walk along those lines, and then get your data in order, because as soon as you show some ROI numbers, you're going to create appetite for them, and people will ask you more and more. And if your data is not ready, then you will create expectations and won't be able to deliver on them in terms of showing the real ROI of the tactics. So get the data in order very fast.
Amazing. Fantastic. And I think that's a perfect note to start to wrap up. Obviously, I'd like to send out a huge thank you to our panelists, Alyssa and Florent, for sharing their insights and experience today. Thank you, obviously, to everyone for joining and contributing to the chat. It's been a very engaging conversation. I think as a quick reminder, we'll be following up with the recording and the notes. We've put a link into the white paper, the digital reality check, so feel free to use that. And I encourage everyone to connect on LinkedIn and continue the conversation. On behalf of the team here, thank you again for being with us. And thank you, Alyssa and Florent.
Thank you. Have a great day.
Thank you. Have a good day. Bye-bye.